Welcome back. All right, so we're talking about Dr. Death.
Reaper, who's Dr. Death?
I know, you all have questions. It's very terrifying. What doctor is named Dr. Death? Dr. Death is Cristopher Duntsch. He was accused of harming 33 out of 38 of his patients. He is a former neurosurgeon that is now in jail. So, a little more on the backstory on Cristopher Duntsch. Cristopher Duntsch was born in Minnesota and raised in Tennessee. He is the son of a physical therapist and a school teacher. Like most young men in America, Chris wanted to play football. So Chris had played in Minnesota, and then he ended up getting a spot at a Division I school at Colorado State University. Go check out the Chris Watts episode. Now, once Chris got to Colorado, it was pretty clear that even though he worked his butt off, he still didn't have it cut out to actually play football. This man had several talents in the game. Once Chris realized that he couldn't really do much with football, he decided to pursue a career in medicine. He completed 2 residencies at the University of Tennessee, his MD, PhD, and a neurosurgical residency. He also completed a spine fellowship. Now, something that's really crazy is that he only completed 100 surgeries during his entire time there. The average is 1,000 surgeries. Now, I have personally worked for a teaching hospital, and for us, if we feel like you're not ready, we will speak up and we will say something, because at the end of the day, you are the one that's responsible for the patient. The entire team that is in that OR is responsible for the patient. If you're not ready, you're not ready. I'd rather you do 1,000 extra surgeries to make sure that you are good, because guess what? You could be practicing on my family member. In his 4th year of residency, he was suspected of doing cocaine, a little coca. The school ended up sending him to a program for impaired physicians. That way he could kind of like get back into the groove. And then he ended up coming back and completed his residency. However, he still only did 100 cases. No thanks. Welcome back to part 3. All right, so we're talking about Cristopher Duntsch and about his early years. What did he do? So he met Wendy Young. They ended up developing a pretty great relationship. They were together for a pretty long time. They ended up having 2 kiddos together. During the first half of Chris's career, he wanted to focus more on research papers, startups, and stem cell therapy, specifically for glioblastomas. By the time that he met Wendy, he was about $500. Let me say this again, $500,000 in debt. So naturally, he decided to go into the neurosurgery route. Since, he did all that training, why not just go ahead and practice? The couple ended up moving to Plano, Texas, where he ended up getting his first job at Baylor. Now, what's so crazy is that Chris actually ended up padding his resume. He said that he had spent about 15 years in training with his undergrad, his fellowship, and his residency, not in that order. But basically, he just said that he had done all this training. He even said that he had graduated with a doctorate in microbiology from St. Jude's Children's Hospital. At that time, that wasn't even offered. What's terrifying is that the hospital didn't even check. They did not vet the surgeon. Had they vetted him, they would have known, red flag, red flag, red flag. The hospital ended up hiring Chris as a minimally invasive spine surgeon, making around $600,000 a year plus some bonuses. It's not a bad way to pay off your debt, huh? While Chris was at Plano, he ended up running into Dr. Kirby. Now, Dr. Kirby was not a fan of Chris. He was one of the 2 that ended up reporting him to the Texas Medical Board and took so long and took all the time to go and actually pursue him. In the next episode, I'm going to talk about all the people that Chris actually maimed. One of them was actually his best friend, Jerry Summers, that he knew from back in the day. Ended up turning him into a quadriplegic. Now, a lot of these stories are pretty heartbreaking, and it's very sad. It does include 1 death. And when I tell you that you need to do research on your surgeon, you truly do, because people can say any and everything about it. People can write reviews, all these things, but you need to do the research. You need to do the groundwork. Welcome back to part 4. So we're going to be talking about some of the patients that Cristopher Duntsch ended up maiming while at Plano. So the first patient is going to be Lee Passmore. Lee Passmore was a medical investigator. He had had some chronic pain. He went in to go see Duntsch, and he left not even slightly bit better. Chris ended up cutting a ligament. He ended up misplacing the cage that needed to go in there. He ended up stripping screws, and it had gotten so bad to the point where Dr. Mark Hoyle, who was in there helping with the vascular aspect of it, providing exposure, he ended up physically restraining Duntsch because he was so disturbed by what he was doing. Now, this makes me wonder, where was the rep during all of this? During spine cases, especially if you have to place any sort of implant or hardware or screws, you name it, there is a rep from the medical device company that sells these products, and they walk you through the surgery. Now, the surgeons can do this a gazillion times, but at the end of the day, you still need help. You are not the end-all be-all. The second patient is going to be Barry Mongoloff. I apologize if I say that wrong. He was the owner of a pool service. He came in. He ended up leaving with bone fragments in his spine, which ended up causing him very limited mobility on his left side. He was pretty much paralyzed and wheelchair bound after that. Now, this one's pretty sad. This is Jerry Summers, who was Chris's pretty much long-term friend. He came in because he needed to have 2 vertebrae fused. He left being a quadriplegic. Chris ended up dissecting some of the neck muscle that was on there, and later on they had said that he was surprised that his spine was even still attached. Because Chris had removed such a large amount of muscle and nerves, Jerry was bedbound. He had no way to move around. Like I said, he ended up becoming a quadriplegic, and it was pretty rough. That's his best friend. Summers, during recovery, had said that him and Chris had done cocaine the night before. Now, I don't know about you, but I'm not going to go and do coke with my surgeon who's going to be inside of my body with my spine out of all places. Just, that's pretty bad on both parts. Now, I am not victim blaming in any way. However, you got to think about stuff like that. Now, Dr. Death earned his name with this surgery. Kelly Martin had come in for a very minor and routine procedure. He ended up severing a major artery, which caused her to bleed to death. During the case, anesthesia was like, hey, there's a lot of bleeding that's going on. We should probably get that under control. And he was like, I need to get it under control. I'm the one that's operating. Ultimately, Kelly ended up bleeding to death. At this time, Plano was like, we should probably let you go. If they ended up firing him, they would have had to report him to the... So after Duntsch ended up leaving Plano, he ended up going to Dallas Medical Center. Again, they didn't vet him. They did not check his references. They only saw his resume. Had they known, they probably wouldn't have hired him. However, it came up pretty quick that the surgical staff that had worked with him, they had noticed that his pupils were dilated, and they had thought that he was under the influence. But why they didn't say anything is beyond me. Again, I can't stress this enough. If you see something, say something. That could be your family member. That could be your friend. That could be somebody you know off the street. But either way, nobody deserves to have a crappy surgeon. Duntsch ended up lasting about a week until Dallas Medical Center pulled his privileges. Why? Oh, I don't know. Maybe because he killed a patient and then he maimed one too. Duntsch had worked on a patient named Floella Brown, who he ended up severing an artery. And after he had severed the artery, he tried to pack it with a substance to prevent any more bleeding. He ended up packing too much, which ended up causing her to have a stroke. While she was in recovery, they had reached out to him several times, and he didn't answer. He was pretty focused on his next patient. He was very focused on Mary Edford, which she ended up having an elective surgery. During that time, the hospital was like, hey, do you want to do anything with Brown? Do you want to transfer care? He was very, very adamant about not transferring anything. He was like, whatever, she'll be fine. Brown ended up having a stroke, slipped into a coma, and then ultimately died. His privileges got pulled immediately. Now, with Edford, I don't know what this man was doing because he had drilled holes on the wrong side of the spine. He had pulled out some muscle. He ended up severing a nerve root. Like, it doesn't make any sense. It was like he was just tinkering around, just playing. It's like one of the quotes that they had said was that it seemed like he knew what to do and then just did the opposite. And again, I wonder, where was the rep? As a surgical tech, you are in charge of handling the instruments and providing the implant for the surgeon once it's opened by the circulating nurse. And for me, I would sit there and say, no, something's wrong. Sir, why are you drilling here? Why are you doing that? This is wrong. I have no problem speaking up because I'm supposed to be the patient's advocate. They're asleep on the table. They don't know what's going on. That's everybody that is in the OR room. Goes for the anesthesiologist, the surgeon, the circulating nurse, the surgical tech. The reps are allowed to speak up too. Again, we're all here to help the patient. Duntsch obviously thought he was invincible. So what does he go do? He goes and applies at University General Hospital in Dallas, Texas. In 2013, a patient by the name of Jeff Gladwell came in to see Dr. Duntsch. He came in just for a regular cervical fusion. No big deal, right? So we thought. Duntsch ended up mistaking his neck muscle for a tumor. Now listen, I had military training. Even I know the difference between muscle and a tumor. I'm not knocking any sort of military training. It's some of the best in the world out there. However, if I, as a surge tech, can say, that's not a tumor, then I think the surgeon who went to several years of training to do this should be able to do the same. Dr. Kirby had tried to salvage Gladwell's neck, but when he got in there, it was pretty botched. He had said it was the work of a crazed man. It was as if Duntsch had actually tried to kill Gladwell for whatever reason. Kirby was so disturbed that he ended up reaching out to the Texas Medical Board, calling Duntsch a sociopath and deeming him a danger to society and to the Texas residents. And of course, the board had found it very hard to believe that a surgeon who had gone through all of this amazing training would intentionally try to harm patients. So it took a long time for the board to actually take Kirby serious. Ultimately, they ended up calling in a veteran neurosurgeon, Martin Laser, to review the case. After he reviewed it in 2013, Duntsch had his license pulled, which just took way longer than it should have, because if you have multiple surgeons saying that there's an issue, there's a problem, you have several injuries, you should probably stop that surgeon and most likely get them either retrained and figure out what's going on. Duntsch ended up moving to Colorado, and after that, it went all downhill from there. He had gotten a DUI, he was caught shoplifting, he kept having to ask his dad for money. He ultimately ended up declaring bankruptcy, and then he ended up getting arrested for shoplifting. In 2015, Duntsch was finally arrested and charged with 6 counts of aggravated assault, and those were actually felony charges. Yikes. Y'all, I can't stress this enough. If you see something, say something. Remember, don't do murder. Like and follow for part 7, and make sure you go follow me on the gram at thereaper.report. See y'all later. All right, so that's it for Dr. Death. Thanks so much for hanging out. So one thing that I really, really want to make sure that y'all understand is that if you see something, say something. Regardless of your position in the operating room, you need to speak up. If you see that a surgeon may not know something, feel free to suggest something. The worst thing they can do is say no. If you feel that somebody's under the influence, stop them, because guess what? That could easily be you. That could be your family member. That could be your friend. And I'm not saying that you need to go and stir the pot, that you need to cause a big ruckus, but if you see something, say something. It could seriously save a life. Now, if y'all want to see the full story on Dr. Death, make sure y'all head on over to Peacock. They have 2 different TV series that are on there. One is the abridged version of Dr. Death. It has a couple of actors in there, Christian Slater, Alec Baldwin. And then also, if you go on Peacock, there's the undoctored story, which has the actual people who were involved with Cristopher Duntsch. I highly, highly recommend it. Also, thank you so much for sticking around. I can't tell y'all how much that I appreciate it. I really, really do. I hope you guys are liking what I'm putting out. Make sure to give me a whole bunch of suggestions. I have a few more that I'm doing right now. I'm working on my YouTube channel. I'm taking a little bit, but other than that, I'm super excited for what's coming next. Pretty soon this is going to change the name, but if you guys don't already, please be sure to go follow me on the gram at thereaper.report, And yeah, I look forward to talking to y'all soon. Have a blessed day. Don't do murder. Make good choices. Be sure to tell a friend. Bye.